Hey, I'm back again. I promised you guys I was going to be back. I'm here with internationally renowned cannabis expert, Dr. Sasha today. A viewer from you guys on 2 Cents Tuesdays, you guys asked specifically about CBD oil and its relation to treatment for ADHD, a very common question, and cannabis in general as a treatment for ADHD in children. I wanted to come to the source, the world-renowned Dr. Sasha No. You don't know what a great bonus 2 Cents Tuesdays this is to have her here to give you guys a little bit of knowledge today, live from the Momentum in Medicine Conference in Atlanta. This has just been a wonderful time. So, Dr. No, would you please tell us something about you today?
Absolutely. Hello, everyone. What a pleasure it is to be here with Dr. Jarrett, hanging out with you. My name is Dr. Sasha No, and I'm a dual doctorate, board-certified, award-winning physician and researcher, two-time best-selling author, international speaker, and medical cannabis expert. And I help patients using medical cannabis. I help physicians learn how to help their patients using medical cannabis. And I also consult with the industry, medical cannabis industry, to help them to know how to meet the needs of patients and physicians in this space. It's a pleasure for me to be here with you today. Dr. Jarrett actually poses whoever posed that question is a great question. As a mom, I can understand the concerns if your child has ADHD, looking for opportunities to help them. Okay, so when Dr. Jarrett asked me to do this, when you asked me to do this, I thought this is a great topic. We get this all the time, right? And so I can really understand some of the fears when it comes to patients or parents who have children who have been diagnosed with ADHD. And so when the topic of how cannabis or CBD oil can help your patient or your child, I have to tell you right off the top, it's a little bit of a complicated discussion. And so I would always recommend that you find a physician who understands how medical cannabis can help your child and have a really detailed discussion with them. Because, you know, we're having a few minute chat here, but as we know in medicine, that's not how it works. There's so much we need to know about each patient, and each patient is so different. But here are a few things that I can tell you. Okay, so when your child is diagnosed with ADHD, there are multiple options that will be presented to you, be it, you know, behavioral therapy, cognitive behavioral therapy, maybe getting with a behavioral specialist, seeing if that child, if your son or daughter can be helped with just learning some additional skills. And actually, as a parent, learning additional skills. You know, I have 2 children of my own. They're grown now. They're 17 and 19. But I've been where you are with raising children. And it's, other than the fact that it takes a village to raise your kids, sometimes we need some extra help, right, and resources. So, you know, behavioral therapy, cognitive behavioral skills for the child and as well as the parents in the home is super helpful. You'll also be recommended to use medications at times if this is becoming an issue for your child. In terms of just functioning. And so I think that's what really drives the questions for most of the parents, because they're like, oh, I don't want to put my kids on these meds. They're like strong and I want to go natural. And I hear that all the time. Right. So I'm a family medicine physician, so I do see some children as well. And so I get these questions. There are a few things we kind of have to consider because, first of all, let's just talk about the treatment, you know, cannabis treatment in children. We don't really have we have a ton of data for how cannabis can be medically helpful, period. However, when it comes to children, we always have to be concerned about cognitive development, neurodevelopment when we're using cannabis, right? Now, I'm not talking like, you know, obviously we don't want any non-adults using cannabis recreationally, but even when we start looking at how the components can affect the brain, you know, neurodevelopmentally, there's a lot we don't know. So cannabis wouldn't necessarily be the first thing that I would reach for my child. And I'm coming to you as a mom and a physician in this, okay? So certainly you have to speak to your doctor and see if you can, you know, if your patients can utilize some of these treatment options available to them. That's going to be super helpful. But I do understand that sometimes you've tried all of these things. Maybe you've tried the behavioral therapy, you've tried multiple medications, and your child is still struggling. And you're looking for an option that's more natural. And that's where a lot of people are looking to the CBD oil. You know, all over the internet we have this stuff. You know, you can buy CBD oil. You know, I mean, everyone's doing it. What I would say to that is, you know, hemp-based CBD can be beneficial, but there's a disclaimer there. You really have to understand where the product is coming from, how it's isolated, how it's processed. Is it safe? Is it free of microbes and fungus and things that can affect your child? Because if your child is immunocompromised, like, first of all, you don't want a product that's not safe, and these products are not FDA approved. So you have to be cautious with that. But then just really understanding where these products are coming from and is it safe for your child to use. So safety is first, which is why I still defer to standard of care treatment when it comes to ADHD. You know, we want to stick with, you know, standard of care as best we can. Again, I understand the struggle, wanting to keep things natural. I get it. So my recommendation would be find a doc who really knows how to incorporate the option for that for CBD treatment for your child. And if there's an option for the child to be evaluated by that doc, and maybe in your state, if they have, you know, if you're in Pennsylvania, I'm in Florida, we have the ability to help children with the medical cannabis that comes from these licensed, you know, dispensaries that have to follow a lot of rules, right?
That's correct.
And so we know that their standards, at least, they have to meet certain regulatory standards. So I would almost recommend that you look to those companies first than just sort of searching online for CBD oil and giving it to your child. Because there are a million things that could be problematic with that. So be cautious about that. And so I would say talk to Dr. Jarrett, talk to your doc, whoever they are, and really sit down and have a conversation because there are a lot of questions that would need to be answered. So I think that's probably the biggest thing that I would say. For children who it could be an option with, you definitely want to do that under the care of a physician because, again, there are so many things we have to consider for each individual patient. How can, you know, what types of product is appropriate? What concentrations of treatment? How is this treatment going to be, you know, delivered to the child? How do we track, you know, their progress? How do we continue to monitor safety in this child? So in the under 18 population, in the non-adult population, we want to be cautious. It's not like it's not an option. I do have pediatric patients where we do use medical cannabis treatment. These treatments, though, come through a licensed dispensary that follows the state regulations.
Yes.
Does that make sense?
That makes sense.
Okay. Does that help?
Dr. Sasha, this is incredible information, and people don't know that they're getting an internationally renowned expert selling this information who is double degree certified in this. I mean, I don't know of anybody that's like this. So the answer is not simple, folks. People, I know you guys have been asking about this. I wanted to deliver it to you. It's not a simple answer, and there are a lot of things that can go beforehand, including some maybe behavioral therapies and maybe other medication management, but it could be an option for your child as well. But I think one of the biggest takeaways is don't just sit there and try to initiate the treatment yourself, ordering products off the internet that you don't know where they came from or what's really in them. That can really be dangerous for your child. It's really about getting the proper therapy and the person that knows exactly what they're doing.
Sure. And if I can say as well, I consult with parents and individuals all across the country and actually internationally on this subject. So if you have a particular question that you have for your child, please feel free to go to my website at drsashano.com and contact me, and we will set up a time where we can talk about your child specifically, get into details. It's actually, there are lots of questions that need to be asked before you can have an answer. But it would be my pleasure to serve you in this way. And again, you can go to drsashano.com. You can contact me through that website. You can check out my blogs. You can always follow me across all social media at drsashano.com. And if there's any way that I can help you, just let me know.
Wow. Thank you, Dr. Sasha, for this wonderful information. You guys are really getting a treat today with the bonus coverage of 2 Cents Tuesdays with Dr. Jarrett and Dr. Sasha No.
Thank you so much for letting me be a part of your time here, and thank you so much for listening. This is a great thing that you're doing, Dr. Jarrett. It's a pleasure to share this time with you.
Thank you so much. You can reach her at drsashano.com and look her up. She's a wealth of information, and please don't hesitate to contact her. And until next time, I'll see you. Do you have any last comments for us, Dr. Sasha?
I would just say, it's always great, as a parent looking for these options for your children, and you are the advocate for your child, so keep doing that. I love the questions. I love the fact that we even have the option for cannabis treatments for, really for children of all ages, and or as a matter of fact, not just children, but people of all ages. And if it's appropriate use, then, that's a great option for you. I love that we have this natural option, but it's a more complicated issue if that's not, clear enough takeaway. That's what it is. So, again, thank you for listening. Thank you for letting me have a moment in your life where I'm dealing with something with you that is very personal and important to you. And I get that as a mom. So, you've got a great resource in Dr. Jarrett as well. So I'm looking forward to being able to answer any more of your questions that you might have.
Well, thanks again, Dr. Sasha No. This is wonderful. You guys know who I am. You've learned a whole lot about what she does. I'm Dr. Jarrett, your board-certified pediatrician and behavior coach, here to help parents get better health and control over their children. And we're here to do this through our books, 2 Cents Tuesdays. I know it's a Saturday, but 2 Cents Tuesdays, 1 p.m. every Tuesday. And we may revisit this topic again. Make sure that you're sharing this video with your friends, because I know a lot of you guys have this question about medical cannabis and your children. And we may be back again. But thanks again, Dr. Sasha No, for being here.
My pleasure. Thank you.
And we'll see you soon.
Very good. Bye-bye.
Right. Bye, everyone.